So moving from chapter 6 over to chapter 7, we're going to look at mental health. So mental health and the global perspective is a valued component of health, but it's really poorly understood. Most of us know that there is a stigma that exists if anyone gets help or talks about getting help for mental health. And so mental health is defined as a, quote, state of well-being in which the individual realizes his or her own abilities, they can cope with the natural stresses of life, they can work productively and fruitfully, and they're able to make a contribution to his or her community. So if you're unable to do these different things, we start to begin to question your state of well-being and also your mental health. So as I mentioned before, it's a very important part of our health and global health that a lot of people don't think about. So some demographics that I want to share with you of mental health are 26% of Americans age 18 and older suffer from a diagnosable mental disorder in a given year. So this could be anything from schizophrenia, depression, anxiety, I mean, you name it on the list of different mental illnesses. 26% of Americans suffer from a diagnosable mental disorder. So something to note, mental illness is found in all regions, countries, and societies. So that's a big one to remember. Not just the United States is susceptible to mental health. So it exists all over the world. We found that there's no consistent difference in the prevalence between developed and undeveloped countries in regards to mental health. So it's not that, undeveloped countries have more mental health. There's no difference between. And as I mentioned, stigma and also discrimination is highly likely. If a country is not well educated in regards to mental illnesses, individuals can be treated, discriminatory based on their mental illness. And sometimes it's just because other people in their community or country just don't understand. So on the right-hand side, I listed a pie chart here of 555,000 18 to 25-year-olds had co-occurring serious mental illness and substance use disorders, yet only 8.5 of them received both mental health services and substance abuse treatment. So we really, really, really are lacking in regards to the type of health care that exists, that is, not only exists, but is affordable for individuals suffering with mental illnesses. So part of looking at mental health is the global perspective and the influence of research and technology. So we've tried to look at mental health in a lot of different ways. And so we have had the first World Mental Health Day. It was held nearly 2 decades ago. You can see it actually was last month on October 10th. And it calls attention to mental illness. So thousands of people with mental illness are denied basic human rights. And so it's important, just like any other of the monthly celebrations or day celebrations, it really calls attention to mental illness. It tries to wipe away the stigma that exists, letting people know that, hey, we need to talk about this is important, and we need to get help for individuals. Also, the National Alliance on Mental Illness announced the first annual Global Peer Support Celebration. And so this was a day that recognized the success of using peer support in managing mental health and addiction challenges, which is now a really major part of global mental health care. And so the core of that peer support can be summarized as Thomas Jefferson put it: who then can so softly bind up the wound of another as he who has felt the same wound himself? So, oftentimes we find that we relate better to people who are similar to us. So the same would be the case in regards to mental health illness or mental illness. If you know someone who has a similar mental illness to you, you're probably like, hey, oh, great, I'm not alone. There's no stigma in regards to that. So you're able to relate to each other and have that peer support that exists. In addition, mental health was a big proclamation for President George Bush over the years of 1990 to 1999, and it was called the Decade of the Brain. And so this is where the research and technology comes into play, where he started looking at the growing knowledge of brain neuroanatomy and physiology. And so the National Institute of Health and National Institute of Mental Health started to sponsor different initiatives to advance goals that were set out by President Bush. And so they really wanted to raise the public awareness of brain research, mental health. The increasing knowledge really started to shed light on the needs of Americans. And not only did this include mental illness, but they talk about degenerative disorders such as Alzheimer's, stroke, I mentioned schizophrenia, autism, and different impairments of speech and language. So in the United States, millions of Americans are affected by these different neurogenic diseases and degenerative disorders. And President Bush wanted to push and find out, if there were cures or how we could assist individuals with these different disorders. However, mental health leads to different legal and ethical issues. And so in between President Bush's push to look at the brain, the decade of the brain, we have the global burden of disease. So this was a study that was done in 1996, and it was created to measure the burden of disease and injury in a manner that could also, very popular with Americans, assess the cost effectiveness of interventions. So basically, the cost per unit of disease burden prevented. So how are we saving or spending money in regards to looking at individuals who were living with a disability and how that disease burden represented a gap between the population's actual health and then a reference point, which is the expected years of a healthy life. So that measure of your disease burden starts to take into consideration some different principles of how a person should live in regards to your socioeconomic status, race, or level of education. So looking at some of those social determinants, again, had an impact on the global burden of disease. And what we found is that a lot of people lost healthy time due to death. So different reasons why a person may pass away had an impact on the time that they lost or the healthy time they had due to the burden of disease. So the World Health Report looked at different recommendations in regards to how can we better mental health. What can we do policy-wise in order to use our new knowledge of mental and behavior disorders, and how do we do better as a society? So we need to provide treatment in primary care. So as I mentioned, oftentimes mental health care can be expensive, and so it needs to be recommended that the general health can be trained to use their essential skills for mental health care. So if you go in for an appointment, we'll say with your family doctor or maybe your OBGYN, and you start talking to them about some issues that you're having, and they start to ask you about your mental health. It's like, oh, okay, you're having, frequent diarrhea, so are you having headaches? Do you work a lot? Are you eating right? Are you able to sleep at night? Because sleep also has to do with mental health. So, primary care should be able to ask these different things and assist with mental health instead of just having to pass an individual along to a mental health specialist. We need to make psychotropic drugs available. So these need to be available in every country and on their essential drugs lists. So some medications can help to reduce disability, shorten the course of many disorders, and also prevent relapse. And so not every country has these different types of drugs available. We need to give care in the community. So community care has a better effect on quality of life, especially with people with chronic mental disorders. So putting them in an institution or a group home doesn't necessarily always provide the best care for chronic mental disorders. So, by doing this type of community treatment, it's cost effective, it respects human rights, and can lead to early interventions and limit the stigma of seeking treatment. By giving out that type of care within the community, it'll wipe away some of that stigma. With that, we need to educate the public. So that's why President Bush's push on, analyzing the brain was great, but we really need to work harder on educational awareness campaigns in regards to mental health. So we need to get rid of that stigma and talk about the frequency of different mental disorders and their treatability and how there's a recovery process for a lot of individuals. We also need to then involve the communities and families and consumers. So this isn't just a individual issue a lot of times. So if you think about someone who is addicted to substances, do you think an individual who is addicted to alcohol is going to do well if, after they get through their recovery program and the only place they can go to live is, say, their parents' house or their brother's house, and everyone around them drinks? Okay, how do you think that's going to benefit that individual's recovery and also their mental health? Probably not going to help them out very much. So we need to involve the communities, families, and consumers in regards to talking about, the culture and social conditions that come with mental health. We need to establish national policies, programs, and legislation for sustained action. We also need to develop human resources. So this really needs to start happening more in developing countries. So we need to increase and improve the training of mental health professionals if they even exist. So it's really important to start having more specialized mental health teams. So psychiatrists, clinical psychologists, psychiatric nurses, social workers who can work together to help these individuals in developing countries. We need to link with other sectors. So oftentimes, if it's not in regards to health, period, mental health kind of gets pushed out to its own side, and that's not cool. We need to combine with other sectors such as education, labor, welfare, and the law, and other non-governmental organizations. They should be involved in helping with this improvement of mental health in the communities. We also need to monitor community mental health. So we can do this through different health information and reporting systems. We can detect mental health changes resulting from external events such as disasters. We can look at prevention programs, treatment programs. So while we're giving care to the community, we also need to monitor it. And that's where some of the information technology we discussed earlier becomes an important factor. And then also with that, we need to support more research. So part of those educational and awareness campaigns really need to also push the issue of research. We need to increase our understanding of the biological and psychosocial aspects of mental health. And this is around the world. We need to start understanding the method of mental disorders and the development of more effective interventions to help individuals across the world with these different mental health illnesses. So within North America, about 2 million Americans have a self-reported mental disability. And so the Surgeon General talks about, in 1999, they reported on mental health, stating that in the report that mental health services issued a challenge to the nation as a whole, to the United States and to health and social services and other individuals, that we really needed to take action and collaborate on generating the needed knowledge about the brain and the behavior, and then also translating that knowledge into the service systems and action by citizens. So he called basically a social resolve to make the needed investment to change the attitudes about mental health. So we need to bring in a healthy era of mind and body for the nation. So something that I find so funny is every time you turn on the television, there's some kind of dieting commercial or a workout machine, right? So anymore, we push so hard to work on our physical health, but do you ever sit down and just think sometimes doing nothing for a few minutes or sitting in silence is really a benefit to your mental health? So I think oftentimes we focus so much on our physical health, and as the Surgeon General stated in that report, we need to focus on a healthy era of mind and body for the nation. So this report then in 2001, so just a couple years later, led to the New Freedom Commission on Mental Health. So this was convened to conduct a comprehensive study, again, in regards to U.S. mental health service delivery systems and issues on specific methods to help improve the system. So this Freedom Commission was a big step in making some of those pushes to make sure that mental health services are not fragmented or disconnected anymore. And in 2008, this same Freedom Commission started looking at our veterans. So many individuals hear about the different campaigns and fundraising for our veterans who have come back from deployments, either recent or decades ago, and how they're really impacted, or their mental health is really impacted while they're deployed. And unfortunately, so many veterans have PTSD and have committed suicide, and so they're pushing to prevent that from happening. We don't want suicides to exist anymore from our veterans who, fought hard for our country. And so they push really hard, started in 2008 pushing really hard with the New Freedom Commission to work on getting assistance for our veterans and their mental health. So in Canada then, they also established a mental health commission in 2005, and so the purpose of that was to provide leadership to make mental health a long-term priority of governments. So they were working on research and making the best practices, and also, like the United States, reducing that fragmentation of mental health and having mental health and illness policies, programs, and to develop a strategy as well to increase awareness and reduce stigma. So as you can tell, kind of worldwide, there is a stigma and a lack of awareness in regards to mental health. So from that Mental Health Commission, they created the Canadian Collaborative Mental Health Initiative, which was funded for 2 years by Canada's Primary Health Transition Fund. And so it was one of the important systems that they created in order to work with mental illness. And they found that 1 in every 5 Canadians experience a mental illness during their lifetime. So it was important that they started this initiative to address the complex issues that exist with physical and mental illness. And then they created the Mental Health First Aid Program. So the Mental Health First Aid Program helped to establish connections for a person developing a mental health problem or experiencing a mental health crisis. And so this program provided that point of access to considerable training to improve mental health literacy while increasing recognition of signs and symptoms of different mental health problems. So people with this type of training, whether it be in a professional setting, they would be able to provide appropriate mental health services to different individuals. And then Canada also launched in 2010 a peer project, which was a peer-based education strategy aimed specifically at youth in schools and adults within the workplace. So if you think about 2 of the most stressful places other than the home for youth and adults, it's school for youth and oftentimes the workplace for adults. And so this peer project was created in order for individuals to be encouraged by innovation within specific programs that were geared towards mental health. So it was supposed to assist with psychological safety in the workplace and also in schools for the youth. So moving from Canada to Latin America, mental health is a major concern in Latin America as well. They find that 125 million people suffer from mental illness, and less than half have any type of access to treatment. So Cuba, El Salvador, and Guatemala focus on community-based care. So that was something that we spoke about a little bit, was, doing that type of work in the community, and policies mandated that decentralization of mental health services, and it moved them from a hospital setting to more of a community level primary care. So there is a lack of healthcare in general for indigenous people, and that also relates to a lack of healthcare within their mental health. And also the Pan America Health Organization, it conducted a mental health assessment specifically of Latin American countries, and some of the findings included that the burden of mental and neurological disorders was about 22.2% for the total burden of disease measured in disability adjusted life years, so dailies, you'll see that used frequently. And then also the most common neuropsychiatric disorders are of unipolar depressive disorders, and then disorders produced by excessive use of alcohol. So there are some social reasons that sociologists want to look at in regards to why Latin Americans use alcohol so much and why they're so depressed, and why some of that stems to the 125 million people that suffer from mental illness, and what can they do about that in order to change this ever-growing problem. Moving from Latin America to Europe, we can see that countries in the World Health Organization European region face mental illness problems. About 27% of people within that European Union experience mental illness. Depression is the leading chronic condition for the European Union. And they have different policies and services that vary across the region. So there's some community care, which is shown to have a better quality of life and greater satisfaction, but then the number of institutional beds are decreasing, so that community care then has to increase, but there are limited services available in the community. So a lot of patients are still treated in large mental health hospitals. They have also created something called Project Shift, and Project Shift works with young people and public services and professional and private organizations and the media to promote communication and disability rights. So they don't just look at mental health, but they work to promote these different human rights. Another program similar to Project Shift is Our Choice in Mental Health. So this encourages the exercise of choice among people who use mental health services and their caregivers, and it provides them with the best practice models to be used as a basis for developing future programs. So it might look at an individual who would be on a 3-year program of innovations in community-based mental health nursing, which was developed to include sites in the United Kingdom, Germany, and Italy, and it will also focus on the type of training that they would need to develop these non-institutional approaches to mental health. From Europe, we'll move over to Africa. And so Africa finds that psychiatrists to the population is about 0.05 per 100,000 people. So Africa, about 79% of African countries spend less than 1% on the health budget on mental health. Okay? Less than 1% of the country's health budget is used for mental health. That is an extremely low percentage. So this is a perfect example of what I was discussing, of how, we focus so much on our physical health and diseases that are occurring, but we don't focus on our mental health. We know that in Africa, AIDS contributes to psychiatric morbidity. So AIDS exacerbates the consequences of hunger, displacement, and a lack of material resources. So, compounding with that fear of mental illness is a lack of mental health workers in most of the countries and the existence of only a limited drug formulary. So they're unable to get those different type of psychiatric drugs that they need to better themselves. Now, the World Health Organization looked at a mental health improvement for a nation's development in 2007, and they did find that Ghana reported that mental health services are available at most levels of care, but the majority of care is provided through specialized psychiatric hospitals with less funding for general hospital and primary care-based services. So the current law supports institutional care to keep mentally ill people off the streets and to protect their assets. So instead of doing community care, individuals with any type of mental health disorder would have to be placed in a type of institution. Then moving from Africa over to Asia and the Western Pacific. So they are really striving to improve their mental health. They've started to focus hard on different crisis interventions after the tsunamis that existed. They really pushed to change the way that they look at mental illnesses in their country. So they're trying to change the idea of the shame and stigma that is commonly reported by individuals in this region. The Pacific Island Mental Health Network was launched in 2007, and so it includes 18 different members, and they found that this actually has made considerable progress in raising the awareness of mental health issues in these different countries. So the government of each member country has nominated a specific leader to direct national activities in collaboration with a specifically designated in-country mental health team. So, I mean, you can understand by just what I said there, they're really pushing to make a big difference in this by, picking out leaders who work together with other, individuals on a mental health team within the country. And so they find that there's many challenges that have faced mental health services within their countries, but there has been some progress in development of different human resources and an expansion of use of primary health as a workforce to build services for people with mental health problems. And so lastly, another one that was held in, or that was created in Hong Kong, was to help erase the long-held stigma and promote the delivery of mental health services in community settings. And so innovations such as the Mood Disorders Center in Hong Kong, which was developed in 2001, they created a hotline to bypass the different taboos of people talking about depression. So within Hong Kong, it's not something that you would ever see to go to a face-to-face psychiatric facility for, therapy or counseling. So they created a hotline where, it appeared to be anonymous, and the phone lines were heavily used oftentimes by people asking for help, and they were provided a point of contact regarding reports of fatigue, headaches, poor memory, which are often correlated to depression. And so the Mood Disorders Center, which was created by the Chinese University of Hong Kong, also trained family doctors in order to better look at, how to recognize and treat anxiety disorders. So very similar to what we talked about before, and having your family doctor or your primary care physician or your OBGYN, recognize those different elements of anxiety. Hong Kong was pushing to do that. They wanted to make sure that their family doctors were able to recognize these different ways and making it a face-saving way to help people help people who were seeking treatment. And so it's still operating in 2015, and your textbook has a website for the Mood Disorders Center. And so they found that a program known as 686 was implemented in China in 2005, and it was created to improve access to evidence-based care and also to promote human rights for those with severe mental disorders. So the initiative was focused on unlocking people with severe mental disorders who were oftentimes, unfortunately, found under some form of restraint in their homes without any type of treatment, especially those living in poverty. So people who were unlocked and did not need hospitalization entered the 686 program. And so this was an important program that gave an individual a physical exam, a psychiatric diagnosis, treatment, medication, regular follow-up visits, and a community-based rehabilitation with no charge. Okay, so you think about individuals who may have, whether it be a mental illness or they could just have Down syndrome or Alzheimer's, different factors that exist with these different mental illnesses. I mean, I can barely imagine people living in poverty who have chained up, their elders or their son or their daughter or their cousin, because they don't understand and they're not aware of how to treat mental illnesses. And so the 686 program is important because family members are able to, assist these individuals who have been, quote, locked up and unlock them and take them to the 686 program where they can get assistance. And so that's all I have for chapters 6 and 7. I hope you were able to learn a lot about our social determinants that affect your health around the world, and then also some of the different global perspectives in mental health. And I hope it was interesting and maybe kind of shocking in regards to countries who are doing better at mental health assistance or doing worse. I always find that it's interesting, we think a lot of times that countries like the United States and England are, the best of the best and tops at these different healthcare issues, but then you find out that other countries are really pushing hard to help their individuals within society. So I hope everybody has a great week.